Welcome to Afternoons on 11. I'm your host, Christine Buck, and I'm in for April Simpson. It is a promising treatment for multiple sclerosis, but the FDA has not approved it. It decided not to approve this drug called Lemtrda. It's a major blow for patients running out of options. Many people who suffer from MS in the United States are upset with the FDA for not approving the drug Lemtrda. Doctors say they've been using it with remarkable results for their patients. The FDA's decision especially devastating for those who've exhausted other treatment options. And now a petition has been circulated to fight the ruling. A lot of MS patients struggling with the debilitating disease are making their voices heard. And we have someone to introduce you to right now. This is Harold Johnson, who has joined us, and we thank you so much for coming to talk about the fact that you were diagnosed with MS, and you've been living with it since 2005? 2005.
Diagnosed in 2005.
Diagnosed in 2005.
Yes.
So when did your symptoms start, and talk about how it's changed your life?
The MS has made me appreciate the small things in life, but it's caused balance problems, walking problems, taking a simple drink of water. I used to choke a lot, just taking a drink of water in the morning, eating cereal in the morning. That was very difficult.
Is that how it started to manifest itself, that you were losing your balance and trying to figure out what was going on?
My right eye went bad.
And vision is often a problem?
Yes, double vision, things like that, slurred speech.
So you went to the doctor and then you got the diagnosis.
Yes.
And up to that point, did you know anyone or even know about MS?
No, I didn't. I didn't know what demyelinization meant, but I do now. You know, I've become kind of a half doctor.
Yeah.
You know,
more than you ever wanted to know.
Anytime I get on the net, it's always medical stuff I pull out now.
Right.
You know?
And when talking of medical stuff, you started in the trials with this drug Lemtrda, right?
Yes, Dr. Barry Singer got me on the trial of Lemtrda. It's been wonderful.
And why has it been wonderful? Tell us what it did, how it helped the quality of your life.
It makes me feel great. I can walk, I can talk, I can take a drink of water now without choking. And I have 2 canes and I have a walker at home. And they're gaining dust. I haven't used them since I've been on the trial. And the active lesions that show up on the MRI are no longer active. And
you're talking about in your brain?
In my brain, in my spinal cord. Yes, no active lesions.
Wow.
It's amazing.
So for you, it's been a dramatic difference.
Yes. I never thought I would come across something like this in my lifetime. I figured maybe in the far future, but now I'm part of the future.
Yeah. So when you heard, I guess in December, late December, that the FDA said that they weren't going to approve this drug for MS patients, your heart must have sunk.
It really surprised me because I went out there and I talked to the FDA committee and gave them a good story along with some other people, and the MS Society was there saying that they need options for people, options such as Lemtrda that they can choose to
just so they could have options, so they could have choices. And you knew that this was something that has been helping you so much. And I can't imagine to be involved in a trial for, what, a couple of years, and feeling how wonderful that is, and maybe looking forward to the fact that it would be available to you. It's tough, and you know, obviously we can see how tough it is for you. You know, to have your life change for the good.
Yes, for the good.
Yeah.
Thanks to Chen and Dr. Barry Singer and everybody else in the clinical trials, this medicine is available to me, and I hope someday soon it's available.
MS patients are getting sort of organized now and signing petitions and trying to get the FDA to listen, right?
Yes. MSMove.org is a website where they can fill out a petition.
We'll put that on our website so that people can go to
for
it.
Lemtrda, and it'll send a note to the FDA wishing for them to approve the medicine.
Yeah.
It's like somebody came up to me the other day at work, and they said their friend has advanced to a walker. She has MS, and he asked me if the medicine is available. And I had to tell him no.
And that hurt. Yeah, I'm sure that does. But I can't imagine abandoning that walker and knowing that, hey, you know, I can do this on my own, because that's what we want. And we just, any one of us, right? We just want to have independence.
Yes, and happiness.
Yeah.
And I have a lot of happiness in my life.
Yeah, tell me a little bit about your life. Are you married?
Yes, I am. I'm married to my beautiful wife, Jessica Johnson.
And when you go through this, she goes through this.
Yes, she does. And she's pulled me through everything.
Yeah.
And she's there with me during my infusions at the hospital, which is far and few in between.
Yeah,
now.
You don't have to take as many, do
No,
you, with Lemtrda?
My first medicine was injections 3 times a week, and it was fairly okay. It had slowed down the rate of my active lesions, but it wouldn't stop them.
Exactly.
I had like a big one here I couldn't turn off. And as soon as I did the Lemtrda, the very next MRI, all the active lesions stopped.
That's what I was going to ask you. When you did your first therapy with Lemtrda, how long was it? You said just the next appointment. There was a big
3
difference.
weeks, I felt like Superman. Within 3 weeks. And
Wow.
then I did an MRI, I think a few months later, and all the lesions are turned off. They're still there, but they're not active anymore.
Right, and when we say a difference, again, that word dramatic difference is what we're talking about.
Yes.
It's how this really, really helps. So
Yes.
this is a sinking feeling for so many people dealing with MS that had so much promise and hope, hoping that the FDA will, I guess, change their mind. They have to go through clinical trials again. This goes on for a long time, right?
I know Genzyme's appealing their decision, the FDA's decision, so hopefully they'll decide in a more positive way.
And that's Genzyme is the name of the drug company?
Yes.
Yeah. So there's a lot to talk about, and you mentioned Dr. Barry Singer. You kind of like him, right?
Oh, yes.
Well, we're going to introduce him. We're going to introduce him to everyone.
He's very knowledgeable.
Yeah, he knows what he's talking about,
Yes,
right?
he does.
And he's helped you, and it's always great to have someone like that in your corner.
Yes.
Yeah. Well, we're going to introduce him to our audience when we come back. So stay with us, and we'll be right back with Afternoons on 11. Welcome back. If you're just joining us, we are talking about a drug that has been rejected by the FDA. It's a drug used for multiple sclerosis, and joining us now is Dr. Barry Singer, and he's the director of the MS Center for Innovations in Care at Missouri Baptist. Hi.
Hi.
Thanks for joining us.
Christine.
And here you are with Harold. You know, before we went to break, we talked about this, but what we didn't mention, or I didn't mention, is that this drug has been approved in some 30 countries.
Yes, it's recently it got approved by in the European Union, so in Europe, also in Canada and Australia, and other countries it's still being applied for. So around the globe, people are going to have access to this treatment. And interestingly, this will be the first treatment that has not been approved in the United States that will be available elsewhere for MS.
And so tell me, from your perspective as a neurologist, you know, treating patients with this drug, what is the name of the drug? I know Lemtrda is the name that we call it. What is it actually?
Alemtuzumab.
Yeah, that's why we say Lemtrda.
Yeah, exactly.
Yeah. So what is it like for you when you were involved with the FDA trials to be working with this drug and to see this dramatic change in many of your patients, and then to hear that the brakes are on it?
Well, you know, as a kind of patient advocate, as a doctor, really our goal is to have as many options out there for patients with MS, and we did have several patients, many patients that were ready for this option. It wasn't for everyone. The drug knocks out some of your immune cells, T cells and B cells, for part of a year.
Lowers platelets in some cases?
Yeah, that's a potential risk. So it's not for everyone, but there were some people that really needed another option. Their disease was out of control, or they were on other medications that had high risk, and they really needed this option. So we really wanted it. And the data for the medication was very convincing. Compared to the injectable medication that's been out there, self-injected medication 3 times a week, it dropped attacks in half.
Yeah, I mean, isn't this where you go maybe just once a year or a couple of times?
Right.
And you do. And is this a drug that has been used and approved for treating patients with leukemia?
Yes, that's correct. So it has been on the market for cancer in the past. It's now no longer on the market except for compassionate use in the United States. So we don't really have access to it now. But the data was very, very convincing. What the FDA was concerned about is in the trial, people knew whether they were getting the annual infusion or they were getting the shots.
Okay, so when you do a blind study, you don't want that to be so apparent so quickly, but I guess the effects of the drug right away is maybe nausea. You could tell right away.
Yeah, but people getting infusions, there can be infusion reactions.
But is that so unusual?
No, you can get hives or infusion reactions as it's going in, and the other medication had side effects of achiness and flu-like symptoms, so you would kind of know which one you were on. And there's always discussion with the FDA even before the trials begin. So as an investigator, we assume that the trial design was going to be adequate. And what we do is we painstakingly have a neurologist who is not involved in the trial, who does examinations to confirm that people are doing, who's getting worse in terms of disability and who's not. And then we have MRI data that can't be influenced by the blinding.
Okay, we have talked about what MS is, but there's a very common form where 80% of patients have. And what is that? And is that what Harold is dealing with?
Yeah, so most patients, almost 85% or so of people have relapsing remitting disease.
Okay.
And what that means is visual loss out of one eye, maybe for a month or two, or numbness in your feet that comes up your body, up to your torso, and then that goes away over a couple months. So you have attacks, but you can have residual disability. But without treatment and over time, a lot of patients go on to progressive disease, where they slowly get weaker and weaker over time.
And there's no cure.
Not
which
yet.
is what
We're
there's no
working
cure,
on it.
and that's what you're working on. And so, Harold, when you got the diagnosis that you have this, that 80% of other people have, then you know that it's something that's going to be progressive, and then you find something that's helping you.
Yes. I thought I was on a one-way track, but the track now is up in the clouds, very positive, very much full of happiness. And like I said earlier, I'm very happy to be here and be alive.
Yeah, I mean, you really do learn to appreciate the small things in life.
Yes,
and as a
you
doctor,
do.
to be able to help your patient has got to be, the ultimate. That's why you're
it's
doing
great.
it.
And
right?
we've made tremendous progress. Going back to 1993, we
Yes.
had no treatments. And in the past 20 years now, we have 10 FDA-approved treatments. In fact, 3 new oral medications that we've been involved in clinical trials at Missouri Baptist and part of the PJC Medical Group. So we've been pushing the ball forward. So we have some new options and new treatments, which is great. So many people have tried medications, they're not taking them regularly, so now we have new options.
But not this one.
No.
So, is there a story behind the story that I'm not getting here? Why the FDA is not approving this?
Well, I think part of it is, when you have a discussion with the FDA about approving a drug, there's a group of people that are involved in those preliminary discussions of how you're setting up your clinical trial exam, what's adequate. And then by the time you finish these trials, you're 4 years later or so, you're having discussions with different people at the FDA who may and the ball changes over time.
Yes.
So unfortunately, if you get with someone who thinks that trial design is not adequate, basically in the advisory panel, people said the efficacy, how effective the drug was, should allow for approval. I mean, they basically said that, but then the trial design becomes an issue.
So where do you go from here? What are you going to do, Harold, to try and push for this, to get acceptance?
I'm going to promote this medicine every day of my life.
Okay.
In a positive way. It has done wonderful things for me and continues to do so. Lemtrda is what the FDA should approve, and hopefully they will. I understand what the FDA is there for, is to filter out bad medicines before they hit the market. But, this medicine has done so well for me and for other people that's on the clinical trials. It's amazing. So hopefully they take a real good look at it.
Have you seen, Doctor, in the past, other medicines that were rejected by the FDA that finally they came around to approving in a short period of time? Or does it take a long time before they
The appeal process can work. And from what I understand, it happens in a minority of drugs get through. We hope with some advocacy. I know the investigators, as one of the investigators, we signed a letter to the FDA. We've been trying to voice our opinions as MS specialists around the country. We really need this drug for another option for our patients. And then the petition that's going on in moveon.org, so people can go on moveon.org, and that's actually the patients advocate. But hopefully with the national organizations, National MS Society, and other advocacy groups, we can get the word out. So at least we can get a fresh look at the data and see if we can get this approved in the United States.
But when the FDA says, we're not going to approve this, then do you have to go back to square one and start all over again? And does that take a long time?
Yeah, so
and then
if the
in that period of time, you think of all the people that could be getting help.
That's exactly right. And they said trial or trials. So, and that's a huge investment for a company to redo after spending hundreds of millions of dollars. And then there's patents on the drug, so we don't even know We don't know how long, you know, is it even going to make sense for them to try to get it in the United States.
Yeah, so some people may say, you know, I don't have MS and no one that I know has MS, so how does this pertain to me? But then you think of the bigger picture and regulation and the FDA and what goes on, and it's important for all of us. It's all of our issue.
Right. To have our voice, to have those drugs available to us as soon as we can.
Yeah.
Clearly, we don't want drugs that are dangerous out there and drugs that can hurt people or haven't been shown to be effective, but we think this drug has been shown to be effective.
Okay, well, how do you feel about this at home? You can go to Ch11 and leave your Facebook comments, and we'll read some of those a little later on in the show. When we come back, we'll discuss many more issues surrounding this drug, and we'll read some of what your comments are, and we'll continue to hear from Harold as well as Dr. Singer, so stay with us. Welcome back to Afternoons on 11. We're talking about a drug called Lemtrda that the FDA says it will not approve in the United States, but has been approved in 30 other countries for the treatment of MS and has helped Harold dramatically, Harold Johnson. And I just asked you in the break, would you go to another country?
Yes,
you don't want to, but...
Yes, I would. I don't want to because I love the United States. But I would go to Canada or Australia, somewhere in Europe maybe.
And the thing about it, doctor, is the treatment. It isn't like you need it every day, every week. You can go once a year? Or
Right. So the first infusion's 5 days, and then you're done, and then the next year is 3 days. And then actually the majority of people went 5 years without any further treatment, which is amazing.
That is amazing.
Well, it's really amazing. But the problem is, you know, people, if we don't have it available in the United States, there's a lot of monitoring that goes on. So there was intensive monitoring during the study. So one of the risks, we mentioned low platelets. So if you, and there's a protocol that was going to be put in place if it got approved, maybe monthly platelet counts, because there's a potential risk of that going down. And there's some monitoring for thyroid. So there's a lot of people that develop thyroid problems on the drug. So, you know, to just go off to a foreign country to get a drug and then have no monitoring in the United States
it's not ideal. It's not what you want.
No.
Well, let's read some of the Facebook comments now. Here is one. It says, I watch my husband suffer every day with MS, and it seems to me if there was something out there that would help relieve any of his everyday pain and depression from it, that it should be available, and that's from Dawn. And I know that there's some people up here shaking their head. Yes, they agree with you, Dawn. Unbelievable that they would turn down anything to help these people. Have seen firsthand the speed at which this horrible disease can take some of its sufferers down, and that's from Sharon. And I have MS. I prefer them to research everything and make sure that it's safe before I take it. My diagnosis was in May of 2013, and I've only tried one medicine so far, but I know many others go through so many kinds, trying different things. So I have to see what works. And I think that that's what we've touched on too, that people say, yeah, you know, I want to make sure that this is being regulated and approved and that I'm not taking something that will make it worse for me. But when you talk about how it's helped, I mean, Cambridge did a research over years, right?
Yeah,
okay.
Yeah.
Well, we'll be right back to wrap things up in a minute. And welcome back. We have to wrap it up. We could go for a much longer time because we have some really interesting guests. But Harold Johnson, before we go, I want you to name that website again that we're going to link people to.
MoveOn.org, and you go down to the bottom and search for Lemtrda, and it'll get you right to the petition.
Okay, and so Dr. Singer will continue the appeals and the push that FDA will come around?
That's right. We want to see if we can get Lemtrda out there for the patients that need it and keep pushing the ball forward in terms of new treatments.
Okay. And best of luck to you. And best of luck to you, Harold. And thanks for coming and
Thank
sharing
you.
your story. We really do appreciate it.
Thank you.
And that's it for Afternoons on 11, and we'll be back on Monday.